Right now on Q6 and live on your mobile device. This is KHQ Local News at 6.
We all rely on our doctors to keep us safe and healthy, but what if your doctor is actually putting your health at risk? For patients at a local plastic surgery clinic, a mistake by their doctor may actually mean exposure to serious disease. Good evening and thank you for being with us tonight. I'm Stephanie Vigil.
I'm Dan Kleckner. We first told you about this story yesterday when the Department of Health told us about an investigation into Jeffrey Karp, a doctor who works at the Spokane Aesthetic Plastic Surgery Center. Well, after the newscast, I received an email through Connect with Kleck. It was from a man named Devin who heard about our story and had a lot of questions. His wife was a patient of Dr. Karp about 2 years ago. He wanted to know what her risk of exposure is, if they have to pay to get her tested, and if there is someone his wife needs to call for legal advice. We asked KHQ local news reporter Alex Rozier to look into his concerns and hopefully get Devin some answers. Alex joins us live right now. What'd you find out?
Dan, good evening. A lot of concern tonight. I found out one thing tonight is that the Department of Health says that anyone who went to Aesthetic Plastic Surgical Center between 2006 and April of 2013, if they had an operation there, they are saying that you should consider getting checked for HIV or hepatitis. Here's how it all began. An inspector with the Department of Health says she first became concerned after she looked in a fridge and found a vial of medication that had been partially used. Many know that those vials should be destroyed after being used on one patient. So the inspector asked the employee in the doctor's office about it, and that employee said that the vials are regularly used on multiple patients, up to 3 different patients.
We were clearly told on 2 occasions while we were in the facility that they are reusing syringes and using vials of medication on multiple patients. That's a clear infection control concern.
Not only are the vials reused, the Department of Health says that they believe that the actual syringes are reused. Those are the needles that go directly into a person. And that's the concern, because if a needle went into somebody that was infected with, say, HIV, it could have been spread to another person. The Department of Health says that could have happened to more than 400 people, and they are urging those people to get tested.
Infection control is very, very important. No one wants to get someone else's blood, be exposed to someone else's blood, someone you don't know who they are and what illnesses they might have. And that's why infection control in situations like this is so important.
So what should Devin's wife do? Step 1 is to contact her healthcare provider, let them know what happened, and ask them for their advice. She should follow the advice of her medical team, but the Department of Health says she should consider getting tested. Please know that health officials in Washington say that the risk of having contracted hepatitis or HIV is low, but you still should consider a test. They also asked about legal advice. Should they seek legal advice? And we talked to the Department of Health about that, and they said that every family individually needs to come to a conclusion about whether or not they will seek legal advice. But the Department of Health says that all problems that were once in effect at this place have now been resolved. As for Aesthetic Plastic Surgical Center, they deny having misused any vials or syringes. They call this information a misunderstanding. They say it's misleading. They say it is inaccurate. But again, tonight, the Washington Department of Health saying that anyone who went there for a procedure, the Aesthetic Plastic Surgical Center, between 2006 and April of this year, should consider getting tested for HIV or hepatitis. Reporting live, I'm Alex Rozier, KHQ.